Yes, sir.
Yeah, okay.
Actually,
So this will be the fifth paper, Intracameral mydriatics versus standard preoperative topical mydriatics in phacoemulsification surgery.
Okay, so good morning everyone. So my topic is the intracameral mydriatics versus a standard preoperative topical mydriatics in phacoemulsification surgery. I have no financial interest in any of the product or technique mentioned in my presentation. So the adequate mydriasis and its maintenance throughout the surgery remains fundamental for the safe and effective completion of the phacoemulsification. And the standard technique to achieve mydriasis involves the preoperative use of the topical mydriatics. However, these topical drops need to be installed multiple times, which increase the patient preparation time, and it may also cause the ocular surface toxicity and sometimes systemic side effects. Also, the maintenance of the adequate mydriasis throughout the surgery can be difficult in some cases, which can jeopardize the successful completion of the surgery. Now, with the ability of this intracameral preparation of the mydriatic and anesthetic mixture formulation like Phenocan Plus in India, it can be the great addition to the armamentarium of the cataract surgeon. And intracameral mydriatic and anesthetic combination has been used in the past in many studies with the good success and safety since a few years. So we planned this study to evaluate the efficacy and safety of the intracameral mydriatic anesthetic combinations and compare this with the standard topical mydriatics in phacoemulsification, which is done under the topical anesthesia. So this was the prospective randomized interventional study. Here the consecutive patient with the senile cataract aged more than 40 years planned for the phaco surgery were included in the study. And the exclusion criteria were history of any prior ocular trauma or the surgery, hypermature cataract, complicated cataract, pseudoexposition syndrome, corneal opacity, etc. So patients included in the study were divided into two groups. The group A, that is the intracameral groups. Here no preoperative topical mydriatics were used, and intraoperatively after the side port incision, the intracameral injection of 0.2 cc of Phenocan Plus were given, and after waiting for 20 to 30 seconds, surgery were continued. And in the group B, that is the topical groups, the topical mydriatics, that is the tropicamide 0.8% and phenylephrine 5% were used 3 times at 10 minutes interval before the surgery. Now at the start of the surgery, the horizontal corneal diameter was measured using the surgical calipers, and all the surgeries were video recorded, and the pupil size were measured before the capsular axis, before IOL implantation, at the end of the surgery. And the pupil size were measured from the screen capture of the recorded video using the ImageJ software, and the pre-measured corneal diameter was used to set the scale. And the primary outcome measures were the mydriasis at different steps of the surgery, and secondary outcome were the patient's comfort during the surgery. So this is a short video clip showing the surgery with the intracameral mydriatics. So this is the surgery done under the topical anesthesia, and after making the side port incision, we injected the 0.2 cc of intracameral Phenocan Plus, and pupil started dilating immediately. And this is just to show the capsular axis. This is done with the 26 gauge 60 top needles. And this is the phacoemulsification being done with the direct chop technique. By manual irrigation aspirations and hindrance. And I will implant it using the hydroimplantation techniques. Coming to the result, the baseline parameters were similar in both the groups. Both the groups had the 40 patients, and the mean age was 64 years in intracameral group, whereas 65 in topical groups. And corneal diameter was 11.6 millimeter in the intracameral and 11.5 millimeters in the topical groups. This is the table showing the pupil size. Before the capsular axis in the intracameral group, it was 7.38 millimeter, whereas in the topical group, it was 8.63 millimeter. And before IOL implantation, it was 7.22 in intracameral and 7.12 in the topical groups. And at the end of surgery, it was 7.13 millimeters and 6.98 millimeter respectively. So we can say the mean change in the pupil size from the capsular axis to end of surgery was minus 1.65 millimeter in the topical groups, whereas it was only minus 0.25 millimeter in the intracameral group. And successful CCC was achieved in all the eyes in both the groups. And patients in the intracameral group reported more comfort and less pain during the surgery. and post-operative course was uneventful. There were no any adverse effects. So coming to the discussion, several studies have already demonstrated the efficacy and safety of this anesthetic combinations and mydriatic combinations. And with the ability of this commercial formulation in India, it has given us the alternate option to use in the place of the topical mydriatics. In this study, we achieved the mydriasis of more than 7 millimeters in the both the groups, and all the other pupils are more in the topical group at the start of the surgery. Maintenance of the mydriasis was better in the intracameral group, and our study is similar into the done in the past. Also, the comfort of the patient during surgery was better. This was mainly because of the presence of the lignocaine in the intracameral formulations. Also, the advantage of intracameral use is the decreased patient preparation time. Also, we can change the order of the surgery among the patients. And none of the patients had any adverse effect related to the intracameral injections. So, to conclude, the intracameral mydriatic anesthetic combination are safe and effective alternative to the preoperative topical mydriatics for prompt onset of the pupil dilatation and a stable mydriasis intraoperatively. Also, it decreases the patient preparation time and better patient comfort during the surgery. These are references. Thank you for patience hearing.
Thank you, Sunil. Have you seen any patients where the pupil didn't dilate?
No, sir. Minimum 7 millimeter dilatation was there.
Okay.
We have already excluded the complicated cases like pseudoexplosion.
There are two things which we need to say here. Like there are sometimes it doesn't dilate even if you use the phenocaine plus. Okay. Sometimes the dilatation doesn't happen as it happens in a topical drops. Yes, and the second thing is, as we saw here, the initial dilatation is much better with the topical group than the intracameral group. You know, the reason is the effect of dilatation is much better on in the topical group than the intracameral group. Just because the lignocaine is there in the intracameral group, during your surgery, there is no feedback from the iris for the sphincter to contract.
Yes, yes.
That's why maybe at the end of the surgery, you have a little better, larger dilation.
Maintenance of the mydriasis was better.
Yeah, intracameral.
Yes,
but as far as to take home anybody junior who are, doing it, use topical, and also maybe you can supplement with intracameral so that you have a better patient comfort and better dilatation.
Yes, sir. We can combine the both.
Did you need to inject the same drug again when you did not achieve the adequate pupil size?
We injected just 0.2 millimeter at the start of the surgery.
Second time or only one time?
Only one time, sir.
And suppose it didn't achieve the desired size of the dilatation, then?
Yeah, we can inject, but in our study we have not injected.
Oh, you did not require?
Yes, sir.
Okay.